I'm Susan Klassen, and I volunteer with the Palliative Care. I come here on a Friday afternoon, and I get the comfort cart ready, which is a coffee cart. And so I go from room to room of palliative care patients and offer them coffee, some cold beverage, a little bit of a snack, and that is my interaction with the patients here.
I would imagine just by the sound of it, palliative care, it might be a bit of a challenge sometime, the situations you find yourself throughout the course of a day?
Yes, some of them are challenging, but I get the strength to go through it, and I've also become stronger through all that, helping patients, maybe putting them at ease, and even going in there and offering a little bit of a beverage or something is a little break for them or their family. And so, yeah, it's some situations, because you can't do anything about it, you just get the strength for it.
And how long have you been doing that role?
I've been doing this for 8 years.
Excellent. Was there any particular connection to Boundary Trails Health Centre that drew you here in the first place?
It's a local hospital, so I wanted to do something local. And I've had interactions with other hospitals in the past for medical appointments, but I wanted to get back to our local community.
Is there any memory that stands out for you in your time in your role?
There's quite a few of them, but I will highlight one of them. There's a gentleman, he was elderly, and when I first introduced myself to him, he was very kind of rough on the edges and, a little bitter and that kind of thing. And with time, every week I would go there and I'd offer him a beverage and snack. And then before I knew it, he was kind of softening up, and he would ask me, when are you coming next time? And I'd say, I'm coming then. So he would take snacks, enough to carry him over till I came the next time. And then it got to be his 90th birthday, and his wife had passed away. He had no children other than nieces and nephews, and they were going to have a birthday party for him in the cafeteria here at the hospital. And knowing that it was his birthday, I came and I put a little plate with all his favorite snacks, and I listened to what was going on in the room, because I like to assess, first of all, what the situation is before I make any comments or anything. And a nurse was in there, and it seemed like it was a good time, so I walked in there and sang happy birthday, giving him his plate as goodies. And he was just tickled pink, so that was very special.
Yeah, you can bring so much to people in your capacity. So why is it important for you to be a volunteer? I imagine that's sort of the stories that carry you forward.
It is important to me. It's an outreach as well. I hope that I am a blessing to all of the patients and families that I come in contact with, and just reaching out. That's my main purpose.
Any advice for people that are on the fence thinking about volunteering? What would you tell them?
I would just say, just go for it. You will get strength for the day. You will get strength for the patients, and I pray for each of the patients before I walk into the hospital that I will be able to say something that will be edifying, or else just keep my mouth shut, and it works every time.